Hey guys, Chelsea the Palliative PA here. So usually I feel like I'm fighting the opposite battle of trying to tell people that palliative doesn't only do end of life care, but now I feel like I've seen so many comments asking why I'm talking about hospice on some of my videos. So I wanted to clarify this a little bit. So palliative and hospice are not the same thing. We definitely have separate roles and we play different parts at times, but both palliative providers and hospice providers take care of patients at end of life. So a lot of times hospice is the provider at home. So primarily hospice is providing end of life care in the home setting, sometimes in like a facility setting, sometimes in a hospice house, sometimes in the hospital. Palliative programs, on the other hand, we are providing care to patients both inpatient, outpatient, and sometimes in the home. But primarily, we are seeing patients at the end of life in the hospital in the inpatient setting. So I am a lot of times either the bridge to getting someone on hospice whenever they are hoping to go home and pass away at home, or if they're too sick to make it out of the hospital, a lot of times I'm taking care of them as they're passing away in the hospital. So the things that I'm talking about with end of life care, yes, hospice could absolutely do this same thing at home, but I am at the bedside providing this exact same care in the hospital as well. So it's not all that we do in palliative, but we are absolutely seeing people at the end of life. So I did want to put this out there for anyone who is kind of confused as to why I'm talking so much about end of life care and hospice. We do a lot of the same things. This is where our role crosses over with hospice. So though we also see patients who are going for cure, who may have a very long lifespan, who not only have a less than 6-month prognosis, but do I absolutely take care of people at the end of life when they're dying? Yeah, I do. So I just wanted to clarify this for anyone who was confused.